This brief presentation is about my quality improvement project regarding advanced care planning discussions and documentation in COPD patients. The four objectives are to define advanced care planning and its significance to COPD patients, identify COPD patients needing these services, looking at the two billing codes, and understand the purpose and goal of this 3-month process change. Advanced care planning. It involves discussions of advanced directives between a clinician and a patient, family member, or surrogate to prioritize treatment goals. This includes hospice care, power of attorney, and living wills. This is important to COPD patients. Since January 2016, advanced care planning services are reimbursed by Medicare and Medicaid, but there are particular set guidelines. Patient and family benefits include education, care aligning with preferences, reduced futile life-sustaining treatments, greater satisfaction with care, decreased symptom burden, better quality of life and death, and decreased stress, anxiety, and burden. It also benefits clinicians and staff with decreased ethical dilemmas. The Greater New Haven area. There are 121 adults per 10,000 with COPD ages 45 to 84 and is more common in urban towns and cigarette smokers. This primary care office serves a large population of these patients and is responsible for managing their care. The Patient Self-Determination Act requires healthcare facilities receiving Medicare and Medicaid funds to ask patients if they have an advance directive, provide written information on rights to make treatment decisions, and make information about advance directives available. The Institute of Healthcare Improvement provides this table of 3 scenarios of patients in different stages of their illness with conversation guidelines for clinicians. The issue. Advanced care planning discussions in practice are inadequate and of poor quality. Only 11% of COPD patients in the office have documented advanced care planning services. There are no policies in place to hold clinicians accountable. This image is an advanced care planning model in the management of COPD and provides a structure for this quality improvement project to implement advanced care planning services early in the disease course and throughout the disease management, not just for acute exacerbations. The purpose of my quality improvement project is to assess, plan, implement, revise, and evaluate a process improvement within this outpatient primary care facility that will increase advanced care planning discussions between the clinicians and COPD patients as evidenced by CPT codes pre- and post-implementation. This will occur over a 3-month period. The intervention includes COPD patients receiving a 10th grade reading level pamphlet. This will address COPD and its progression, significance of advanced care planning and its relation to COPD, and how to have these conversations with a clinician. This will be given at the time of an office visit, and extra pamphlets will be available in the patient waiting area. A similar informative poster board will also be displayed in the patient waiting area. So the goal is to increase advanced care planning discussions in COPD patients from 11% to 14% in 3 months as measured by advanced care planning documentation in NextGen. It's shown that advanced care planning services lower healthcare costs, and properly coding these discussions is important. There are 2 CPT codes, 99497 and 99498. Each are used depending on the amount of time spent as shown in the table. Documentation includes the condition for which the patient is being counseled, patient consent, indication that advance directives were explained, the complexity of the discussion, information if forms were completed, those who were present, and the total time spent. Here is a flowchart of appropriate steps to follow when seeing a COPD patient, providing advanced care planning services, and billing for them. Let's work together to increase advanced care planning discussions in COPD patients from 11% to 14% in 3 months, measured by advanced care planning documentation in NextGen. Be sure to look at the poster board updated monthly with our progress. Thank you.